exploring the use of extraordinary vessels in practice. Extraordinary vessels play a crucial role in TCM by serving as specialized pathways for Qi regulation. They are specifically indicated in complex clinical situations where multiple channels or symptoms are involved, distinguishing them from main channels, which are typically used for isolated channel issues or specific organ conditions. Guidelines for using extraordinary vessels. Extraordinary vessels are indicated when multiple channels are affected simultaneously. Their nature as reservoirs allows them to integrate and regulate qi across all involved channels, ensuring a more comprehensive treatment approach. They are beneficial for complicated chronic conditions with overlapping symptoms across different body systems. Using extraordinary vessels can simplify treatment by addressing the root issues rather than isolated symptoms. When an internal organ pathology affects a channel that is not its primary channel, extraordinary vessels can be utilized to address these cross-channel issues, ensuring a more holistic approach to treatment. Extraordinary vessels are particularly effective in balancing conditions characterized by both heat and cold, as well as fullness and deficiency. Their ability to regulate qi allows for effective treatment of these complex situations. Some extraordinary vessels are particularly indicated for mental and emotional issues, providing regulation and integration that can improve emotional health and stability in patients. Extraordinary vessels can also be used for neurological problems, stimulating qi circulation in the nervous system and addressing conditions like multiple sclerosis and hemiplegia after strokes. When the pulse quality shows the same characteristics across multiple positions, it indicates a need for using extraordinary vessels. This is because these vessels act as reservoirs of qi, affecting multiple areas simultaneously. Problems of several channels simultaneously. Extraordinary vessels are indicated when a health issue simultaneously impacts multiple channels rather than a single channel. This is because they serve as reservoirs of qi, allowing for a more comprehensive treatment approach that integrates the effects across the affected channels. The nature of extraordinary vessels facilitates the flow of qi among multiple channels, making them suitable for cases where pathologies overlap. For instance, a patient with sciatica may experience pain along the bladder channel, which can also involve the gallbladder and stomach channels, necessitating the use of an extraordinary vessel. In treating conditions like sciatica, employing the Yang Chow Mai's opening and coupled points, such as bladder 62 and SI3, can effectively affect the multiple channels involved, providing a holistic treatment strategy. Case study, sciatica and extraordinary vessels. When sciatica manifests along multiple channels, it is essential to utilize extraordinary vessels to address the condition comprehensively. The Yang Chow Mai serves as a reservoir of qi that can regulate and integrate the affected pathways, making it effective for complex presentations. Complex conditions. Extraordinary vessels are particularly effective in managing chronic conditions that exhibit a range of interrelated symptoms across various body systems. By addressing these overlapping issues, practitioners can provide a more comprehensive treatment plan that targets the interconnected nature of the patient's health. Case study, chronic asthma and multi-symptoms. In cases where patients present with multifaceted issues like chronic asthma intertwined with digestive and gynecological concerns, the Renmai serves as a pivotal channel for treatment. This extraordinary vessel not only impacts the lungs, but also nourishes yin and supports the functions of the digestive system and female reproductive organs, making it a comprehensive approach to complex conditions. Involvement of an organ and a different channel. Pathologies of internal organs often do not limit their effects to their corresponding channels. For example, a liver condition might influence the bladder channel rather than just the liver channel. This necessitates the use of extraordinary vessels to address the broader impact on the body's qi. Case study, liver yang rising and headaches. Liver yang rising can lead to headaches that may manifest along the bladder channel, creating discomfort in the occiput area. The yang chow mai serves as an effective tool in this scenario, as it helps to absorb excess qi, thereby alleviating the symptoms associated with the rising yang and restoring balance. Complex situations of heat cold and fullness deficiency. Extraordinary vessels are particularly effective when there are simultaneous occurrences of heat and cold or fullness and deficiency. Their unique nature as reservoirs of qi allows them to harmonize and balance these contrasting conditions, facilitating a smoother flow of qi among the channels. In cases where women experience mixed conditions of heat and cold, the treatment of the renmai or chongmai can be particularly beneficial. These vessels influence the uterus, blood, and various channels like the kidneys, liver, and spleen, making them suitable for addressing both heat and cold imbalances. Case study, mixed heat and cold in women. Women frequently experience mixed heat and cold due to simultaneous deficiencies in kidney yin and kidney yang or blood deficiency. The treatment of the renmai or chongmai is effective in regulating these imbalances, influencing relevant channels, and addressing symptoms such as cold extremities alongside feelings of heat in the face. Mental emotional problems. The renmai is indicated for psychosis after labor, showcasing its significance in addressing severe emotional disturbances. It plays a crucial role in emotional regulation. The chongmai is associated with mental restlessness and anxiety, particularly when dealing with rebellious qi. Its treatment can alleviate symptoms of emotional instability. The tumai influences key organs that regulate mental health, such as the heart and kidneys. It can be used to strengthen willpower, lift the mind, and nourish the heart in cases of depression. The yin wei mai is often utilized in treating conditions like depression and anxiety. It nourishes the blood and strengthens the heart, helping to calm the mind. Case study, depression and anxiety treatment. The yin wei mai, known for its ability to nourish blood and strengthen the heart, is particularly effective in treating mental emotional problems. This vessel helps regulate emotional disturbances associated with depression and anxiety, providing a holistic approach to mental health. Neurological problems. Extraordinary vessels are effective in addressing neurological problems, including multiple sclerosis and hemiplegia. Their unique role as reservoirs of qi allows them to enhance the flow of energy throughout the nervous system, helping to alleviate symptoms and promote recovery. Case study, multiple sclerosis treatment. In treating multiple sclerosis, the tumai and taimai are utilized to stimulate qi circulation in the legs and spine. This approach leverages the unique properties of these extraordinary vessels to address neurological issues and improve overall function. Pulse quality indications. When the pulse quality is consistent across multiple positions, for example, floating, firm, it indicates that the extraordinary vessels are involved rather than just a single channel. This reflects the integrated nature of the body's qi flow and suggests that the condition requires a broader approach to treatment. A floating pulse across all three positions, front, middle, rear, typically indicates a condition related to the tumai, which governs all yang channels and signifies potential imbalance that affects various systems in the body. The decision to use extraordinary vessels over main channels is guided by the nature of the patient's condition. When faced with complex issues involving multiple channels or interrelated organ systems, Extraordinary vessels serve as vital tools for regulation and integration, addressing a wider spectrum of symptoms through their unique properties as qi reservoirs.